The Libido Doctor is in.
Hello and welcome to Libido Doc, a place where we talk about human sexuality with a focus on married women. I'm Dr. Suzanne and I would like to talk about your vulva or your vaginal flower, your feminine flower. Let's first explain what the vulva is. The vulva is the external part of your genitals, which is usually composed of the mount pubis, where you have your hair, the hood of the clitoris, the labia majora, or the bigger lips out there, the labia minora, the smaller lips that usually cover the opening to the bladder where you pee, and then at the bottom you have the entrance of the vagina. That's the vulva. And then below it you have the anus. The first thing you need to know when you clean yourself is that you always have to go from front to back. You go from the vulva to the anus. You never do the anus to the vulva. Why? Because you're going to transport bacteria that are around your anus into your vagina and your bladder, and that can result in vaginal infection or urinary tract infection. The easiest and simplest thing to do is to clean your vulva with plain water, and I would highly recommend to do at least twice a day. Take a shower daily. That's not a negotiation. I personally recommend twice a day. This is a minimum if you want to stay clean, maintain a good hygiene. Twice a day is good, but at least once a day. Of course, when you're taking your shower, you want to use the soap and the water together. If it's not during your shower, let's say you take a shower once a day and then in the evening you just clean your vulva, you can just use plain water, okay? You don't need to add soap if you don't want to. The other thing I recommend to a lot of my patients is to use moisturizing oil. I offer those. It's mainly rose oil, and usually after you clean yourself from front to back a couple of times, then you add a little bit of drops on either a cotton ball or a piece of tissue, and then you moisturize your vulva. I love to do that because it actually keeps me very moist. Now, what about vaginal douche? Vaginal douche is usually done with containers like this that have some liquid. You tie it very well, and then you can push into your vagina to clean deep inside. Your vagina has a specific pH that allows good bacteria to grow. So if you do too many vaginal douche, you will shift the pH and you put yourself at risk for a vaginal infection. Now, I mostly use those after my periods because I want to get all the debris out, and I usually make my own cleansing water with rose petals and a little bit of clove. I boil it, I let it cool, and I use it for a couple of days. That's it. The other thing I sometimes recommend is vaginal gel. I have one that I use also after my periods, and I use it for 2-3 days, and it keeps everything just smelling rosy, clean, and it also removes all the final debris that are just taking time to come down. As far as moisturizers, sometimes after a certain age you have the tendency to be dry, or if your hormones are not well balanced, use, like I said, rose oil. You can use coconut oil. If you don't have this type of oil, you can use hyaluronic acid ovules that you insert in your vagina before bedtime, and you can do that for a period of 5 days just to keep yourself moisturized. Drink a lot of water, of course. Keep hydrated. Now, if you have hormonal imbalance, like it usually happens premenopausal, you can make teas with fenugreek and drink those on a regular basis. It's going to help balance your hormones. You can also drink soy milk. Soy milk has natural vegetable estrogens, and it's also going to help you stay balanced. Other things you can do on your vulva. Sometimes with age, women tend to have loss of volume in the labia majora. I offer a procedure with your own plasma and sometimes with a little bit of hyaluronic acid. I've been doing that for the past decades, and it works absolutely beautifully, where I actually give more volume to your labia majora, and it just gives you a beautiful, nicely shaped flower. Oh, let's talk about the O-shot. O-shot is usually PRP, your own plasma, that we inject in your clitoris. Your clitoris is under that hood, and we do that under local anesthesia. And what do women say after they get the O-shot? First of all, you increase the volume. You regenerate your clitoris. Spontaneous orgasms. I had a patient telling me that when she walks, she gets orgasms. And when you combine that with plumping your labia majora with a little bit of hyaluronic acid, you get to another level of pleasure. No kidding. Usually, who benefits from the O-shot? Some mother. I've had moms who had children, and sometimes they say they don't feel the same sensation as they used to when they were much younger, in their 20s. So this is very, very indicated for them. Sometimes we see women who went through clitoris mutilation also benefit from the O-shot, because for some reason certain women tend to have a regeneration of the clitoris. It's also beneficial when, for example, you have stimulated your clitoris too much, through masturbation or whatever. Doing the O-shot can actually regenerate the sensation and make it even better. So now, after you have the O-shot, how long are you supposed to wait before having the intercourse? You wait 0 time. Like, you can get off the exam table and have an intercourse right away. But the effects are more seen and felt within 24 to 72 hours, and it keeps getting better and better and better with time. What else can we say about the O-shot? Really, anyone can get the O-shot. It's safe. It's your own plasma that we put back on your clitoris. There's no interference with your own physiology, but what it does, it just regenerates those cells and make your nerves, your connections, the moisture, the size of your clitoris much better. If you have any questions, please do not hesitate to reach out to me. You can call the clinic, or you can DM me, or you can email me, or you can visit my website where I offer those procedures, www.libido.live. Okay, my other website is dr-suzanne.com. All right. Well, thank you so much. I hope I answered most of your questions. I love you, and I hope I shared something beneficial for you. Bye.